and then
Just
we'll
2
begin.
minutes.
Yes, sure.
Okay.
We have Dr. Shabir. He has just joined.
Yes.
Dr.
Is
Shabir.
there other slides?
No, there is just one slide. Dr. Shabir, would you be able to help him?
ma'am.
Walaikum assalam. Would you be able to help him?
Yes, ma'am. Yes, ma'am. No problem.
Thank you. Thank you.
Okay.
So I'm resuming. You can tell us once you're
Okay.
done reading and we'll begin.
I'm ready. I'm ready.
All right. So if you have read and understood, considering it communication skills station, please begin.
Hello.
Hello.
I'm Dr. Ali Bade, one of the surgical doctors working in Mumbai hospitals. I'm calling the ICU Registrar. Can I confirm that I'm talking to the ICU Registrar?
Yes, doctor.
I'm calling you regarding a patient with the perforated viscous and AKI and planned for aerial laparotomy. And I would like to ask you advice and also to arrange with you a post-operative bed.
Okay.
Okay. Yes, I have a 76-year-old lady present one day before to the ER with sudden abdominal pain. And on my examination, the patient is known to be COPD and on steroid. And on the examination, the abdomen is tender and guarding. And also on investigation, show that X-ray show that there is air under the diaphragm. And the abdominal ultrasound show there's a free fluid in the abdomen. And also the ABG show there is metabolic acidosis. And also the serum electrolyte showing there is hypokalemia. For this, I'm calling you to ask you about advice and to arrange post-operative ITU bed.
Okay, doctor. So you are going to operate on her. Am I right?
Yes, right.
And you told me that abdomen is tender and there is some fluid collection.
Yes.
Okay. So have you started any resuscitation? And what type of fluid are you giving?
Yes, I will give her the crystalloid fluid, 1 to 1.5 liter in 1 hour.
Okay.
Okay.
And what will do you next?
I will do the preoperative arrangement. I will do ECG for this patient, look for atrial fibrillation and sign of hypokalemia. Also, I will do central line insertions, urinary catheters, and also I will give her antibiotics according to my hospital policies and after discussion with microbiologist. Also, I will give her the IV hydrocortisones, and I will monitor her saturation by giving her oxygen by Victoria mask. Also, I will contact the anesthetist and my consultant.
Okay. But do you know the patient blood group and have you taken blood cross match or not?
Yes. Also, I will do blood grouping and cross matching.
Okay. So can you tell me a little about what's the criteria of admission into an intensive care unit?
Yes, if the patient need one-to-one nurse care, and also if there is a two-organ failure, and also if there is a respiratory failure requiring ventilation, also if there is one organ failure with a possible second organ to be failure.
Okay, so you told me that the patient has a history of COPD. Okay, so what type of
Yes,
oxygen mask are you using for oxygen now in this
yes,
time?
Venturi mask.
Into the mask. Okay, and what will be the oxygen which you are giving to the patient? Inspired
Uh,
oxygen
uh,
fraction.
yes, I will give the patient 4 ml per minute, 4 liters per minute to reach the saturation between 88 to 92%.
Okay, and you told me that your patient has metabolic acidosis with hyperkalemia or hypokalemia.
Yes, hypokalemia, yes.
So how will you correct this potassium deficit?
I will give the potassium 20 to 40 millimole per liter in normal saline, and I will monitor the level of the potassium by ECG and serum electrolyte.
For how long you will give this potassium?
Till to the normalize the potassium between 3.5 to 5.5.
Okay, but how many doses you can give of potassium?
Okay, I will calculate the deficit. If the deficit 0.3, I will give 100 millimole for deficit 0.3.
Okay. So
Okay, if the
how
potassium,
can you okay, how will you will confirm that patient potassium is in normal range?
yes, by taking serum potassium.
Okay.
Yes.
So one thing, if I don't have any bed, or if I have only one bed and there is also another patient coming, she is asthmatic. So who I have to
Okay.
give the preference?
Yes, I have. My patient is urgent. You can try to step down to discharge more stable patient to the general ward. And
Okay.
if that is not possible, I will keep my patient in the recovery room.
Okay. Until the bed is available.
Yes.
Okay, doctor. Okay, doctor. You can manage your patient. I will try to evacuate a bit for you in the intensive care unit after surgery. So you can contact me later
Okay.
on. Okay.
You still have 1 minute and
Okay.
40 seconds. This patient is COPD and definitely she is taking steroids. How would you
Yes.
keep that in your mind? What would you do that?
No,
What more would
he
Uh,
told that I will give IV hydrocortisone.
Okay, but he has to check if patient has taken a steroid inhaler this day or not. He had to
Okay.
confirm that as well.
yes, yes.
Yes. And how have you come up with this diagnosis that this is definitely perforated viscous?
Okay. From the history, patient has a sudden abdominal pain, and on my examination, there is abdominal tenderness and gargling. And also from the abdominal ultrasound showed there's a free fluid on the abdomen, and also the chest X-ray showing that there is air under the diaphragm, and the ABG showing there is a metabolic acidosis. All this goes through my diagnosis for my diagnosis.
Okay. Right. Can you summarize your plan of action at the end, please, for the consultant?
Yes, yes. My patient is planned for urgent laparotomy. I will resuscitate him with the crystalloid fluid by giving the patient 1.5 1 to 1.5 liter, and I will correct the potassium to my patients. I will do the ECG, and doing chest X-ray. I will insert central line and urinary catheters. I will give the patient antibiotics. I will give the patient oxygens in the rate of 4 liters per minute to reach the saturation between 88 to 92%.
Yes. And how frequently would you be monitoring vitals?
I will every I'm not quite sure. Every 1 hour or 4 hours?
Yes, every hour. Okay, time
Every
has
hour,
ended.
yes.
Good, thank you.
Okay.